And new this morning, school shootings, cyberbullying, the impacts of the pandemic, they are all issues that affect youth mental health.
But there is something that you can do to protect your child. Our Candace Charles joins us here in studio this morning. Some very important information and some tips. Candace.
Well, Nevada's mental health care stats are sobering, John and Heather. Take a look at your screen here. According to Mental Health America, Nevada is last in the country when it comes to a higher prevalence of mental illness in children, combined with lower rates to access of care. Now, in 2019, we ranked 7th in suicide deaths, with 12% of those deaths were children and teens. Now, here's the silver lining. Nevada now ranks 12th in the nation. Now, this can be attributed to funding for programs like the Nevada Resiliency Project, the state hiring its first youth suicide prevention coordinator, and the American Rescue Plan dollars going toward needed resources like free support groups through NAMI and more counselors in our schools. But that's only slightly moving the needle. Now, mental health experts say we have to continue to have the conversation to destigmatize mental health so legislators and districts continue to pour funding into this mental health crisis.
Our kids are really suffering. Our kids are suffering. The numbers, the statistics show just that. So we have to meet our students where they are.
It's really important that when they're at school, they have a safe and supportive school climate that can help them address those things.
And there are a number of ways you can help. On a state level, reach out to your legislators. Right now, there are 2 mental health bills that can help address mental health needs, including one by youth and for youth that will require increased learning and support for mental health education and resources in K through 12. Most importantly, folks, talk to your child. The National Alliance on Mental Illness suggests, here we go, take a look at your screen here, explain mental health like a medical problem like asthma or a cold. That there's things that you can do, like take medicine for prevention or relief. Talk to them about what they're experiencing and listen with curiosity and empathy. Discuss self-care and prevention, and don't be afraid to ask about suicide. Now, if you need help, call that number on your screen there at 988, the Suicide Prevention Lifeline. We have additional resources on our website, 8newsnow.com. For now, live in the studio, I'm Candace Charles, 8 News Now.
All right, Candace, thank you very much. Very important to be focused on mental health, to be sure. 6:30.